feet high, weighs about 250 pounds, compared to the diodes now that are so small, and that's what changed dentistry. Is when the diodes came out small, because basically lasers sort of took off in the 90s, and then they dropped off quite a bit. Then diodes came along, and everything's picked up again. So now I think probably diodes are somewhere around 25% of the dental offices have lasers now, from what the last statistics I read. So light is light. So these are some of the very important things to understand why lasers are different than lights. First, it's what's called coherent. So what we've got are, these are the waves of light. Remember from physics, we had to learn wavelengths and all those things. But everything is exactly parallel. So it's very efficient light. So lasers are far more efficient than any other cutting source in terms of energy that way. They're also monochromatic. What's monochromatic means? Light has different wavelengths of light. For example, this is green. That's in the 500 range. We use curing lights. They're in the 400 range. They're blue. We've got red lights. We've got infrared lights. So the laser you've got is actually infrared, so you can't see it, so it's got an aiming beam. So when I say the wavelength, for example, this is IE10. We get to low level, you might be talking 660 nanometers. So each wavelength has different characteristics. So the laser you would use for doing eye surgery is very different than the laser you would use for healing. There are different wavelengths for doing different things. They're also basically very parallel. They're collimated. Like when I do this laser, it's coming out of here. If I shine at the back wall, it's not a lot difference in size. Everything is very parallel. That's why we're talking about lasers in space. As compared to normal light, it's non-coherent. There's all kinds of wavelengths. It's all over the place. It's very inefficient. So this is characteristics of laser light, and this is for both low-level lasers we get for the surgical lasers. There's four things going to happen when you shine light in tissues. You get reflection. So it can hit the tissues and bounce off. One of the things that happens if we hit enamel with the diode laser, most of it's just going to bounce off. So it's not absorbed, so it's not doing any damage. Then you've got transmission, and what that is that's where the light goes straight through. When we get the low-level lasers, that's very important. We want something that's not absorbed by water because we want it to go down inside the tissues. The easiest way to think of that is when they do eye surgery. They actually go to put the laser in the eye and treat blood vessels in the back of the eye. So the laser light goes through the clear part of the eye until it hits the red in the back. That's when it does its work. And then what you've got is absorption. Absorption is what we want. The energy is picked up by the tissues. It's absorbed in there and has an effect, be it heat, whatever the different reactions, according to what different lasers you've got different effects. And then you can have scattering. And what that is it hits and then it moves around. So what you're going to get with the laser is some of the energy's there, some of it's scattering, so you get some basically side effects with it. Okay, this is, remember I said the different colors? This is the spectrum of what we've got. This is our rainbow. That's all that is. So lasers, you can have lasers in all these different lights. I was telling somebody there was somebody's doing research in macular degeneration now, and they're actually using, they're treating macular degeneration, they're actually using blue, green, yellow, and red in terms of doing it. All different wavelengths having different effects absorbed by different cells. And then you've got the near infrared, which is where that 810 is. So it's basically invisible to the eye. So if you just had the laser, you wouldn't actually see anything. So you have a red beam in it that shows you where you're going. But it's a very low power beam. It's basically about the same power as this laser pointer is. And actually you can buy these much more powerful, and this is where all the problems are running into. People shine in the sky pilots. So the more the energy, the more damage it can do. Then you've got out the far infrared, that's where you get your carbon dioxide lasers, which you saw last week. Next, then you get the 70 degrees, that's where you get the tissue welding. And remember I said sometimes you do it and it doesn't feel like it's cutting? Well, it doesn't have enough energy cutting because you're getting the tissue welding. So it almost feels like it's like it's sticking as you go through the tissue. That's telling you you don't have enough power because it's not hot enough. Then you get around 100 degrees, that's where you start getting the cutting. That's where the tissue's cutting, that's the temperature you want to be at. And if you get up to 200 degrees, you get carbonization. presets are a good place to start with, look at them, get an idea. But in terms of doing them, that shouldn't be your guide. I mean, as you start, I would say probably within 2 months of using a laser, you should never use a preset again. I haven't used a preset in I don't know how many years. I can't remember well, actually, probably never, because my laser doesn't have presets on it. I had to set the original Yagi, I set the power, I set the pulse rate. That goes, and that's what it is. When I picked up a diode, I've never used a preset in a diode. So I go to one setting and just move it from there. The only time we'll do presets is low-level lasers, and I'll explain why later.